Hello and welcome to Embracing the Fight. I am Erica Lamar, your digital creator and host. And if you've been with me since January of 2023, you will know that Embracing the Fight is about normalizing the conversations surrounding physical and mental health issues and concerns. And I open up the conversation, talking about my journey through thyroid cancer and all the things that have come along the way, as a result of that and things that happened before, and after that that may have been unrelated. Now, why did I do that? Think about it. How easy, or should I say, how hard is it to let people in, strangers, family members, whoever, how hard is it to really sit down and talk about the things that are bothering you? Because, when people say, how are you? They really don't, they really don't want to know how you are. They just kind of saying, hey, how you doing? And they just want to hear you say good and keep on going. But when it's your family, when it's your friends, when it's the people that you truly love, you should take a moment to stop and listen and see, really how this person is doing. Because what if it's something that has been traveling down, through generations, like depression, that people just, shrugged off as being something else, or schizophrenia or autism, things that you don't necessarily have to deal with, but your family is dealing with. Someone that you love is dealing with, or they're fighting inside and they suffer in silence because they feel like they're going to be, judged. So this platform, I create this platform. So there's a safe space for people to come on and talk about the various issues or things that they're dealing with so that you have someone you can connect to, someone that you can talk to. You understand that you're not in this alone, that we are here, to embrace the fight together. So if you haven't already, please click subscribe, click like, comment, and share on any episode that you see of Embracing the Fight. Like I said, I started back in January 2023, and this is actually episode 90. And episode 90 is just going to be just a little discussion about some changes that are coming, in healthcare. So sit back. I would say relax because I really can't say relax, really, because if these changes affect you, there's some things that you're going to have to do, to get it going, to get started. Um, I don't know. Maybe it's you, maybe it's not you. However, let's start out by looking at Google. So when you are, thinking about your healthcare and you're wondering, what's going on, what's changing, in the world, I was just randomly walking around in Walmart and there was a lady sitting at a table. And you know how we do. If there's someone sitting at a table, you try not to, make eye contact with them or anything like that. But I had, a little pull in my spirit to go over and talk to this lady. So I've learned that whenever, God tugs on me, I need to go over there and do whatever it is because I can't rest until it's done. So anyway, I walked over, was talking to this lady, and she was actually a representative for Medicare. She was a licensed insurance agent, and she was asking me, if I knew about the changes that had come, with Medicare, and I was like, well, um, I'm not, on Medicare or anything like that, but I saw the sign said healthcare and I was curious because I was like, okay, healthcare is really expensive. What's, something I can do or something I can share to people on my podcast that are dealing with the high costs, of health insurance? Because I myself, when I was employed, the job basically said, okay, this is what you get for healthcare and everything is all fine. But when you're unemployed and you say don't have Cobra, but Cobra tends to be extremely high, as well. And that's like that gap insurance that keeps all of your benefits the same. So you can continue to see the same doctors that you would normally see until you get healthcare that is like not, I shouldn't say compatible, but it's comparable to what you had previously. So you don't lose the physicians and you don't lose the coverage that you had when you were employed. All right. So I said all that to say this. Talking to this lady, I'm trying to get some information to bring to you all. And she's telling me that she's not there, to talk about like affordable health care and all this sort of stuff and the different types of Medicare. She's more concerned with the elderly, or people who are on, Medicare, because some folks aren't elderly. They have other things that qualify them for Medicare. But I shouldn't say that. Medicare, Medicaid, Medicare. It's a whole different world when we talk about insurance, because it's not always age. It can be disability. It can be other things. But anyway, she asked me, she was like, what type of insurance, do your parents have? And I basically was like, I think my parents have like railroad insurance, but it's a form, of Medicare. And she's like, well, give them a call and find out, and I can see if I can direct them on what, they need to be looking for, what they need to do. And what she mentioned was this annual notice of changes that should have come to you, already, if you're over the age of 60, I believe 62, something like that. Anyway, I said, let me go on and Google this. So I'm going to show you how, to do it. So hopefully, everything's recording and you can see my screen. But you go to Google and you do the annual notice of changes for 2025. And basically what the annual notice of changes, or the ANOC for 2025, is a document that provides information about upcoming changes to Medicare plans and benefits. It is mailed to Medicare beneficiaries who have a Medicare Advantage Part C plan or a standalone Medicare Part D prescription drug plan. All right, so you should have received this in the mail. I want to say it was at the end of September. And if you didn't receive it, let's go down here to Medicare.gov so it can give you, some more information. So, nothing wrong with Googling something and checking out. So here it is again. It says, well, what is it? If you're in a Medicare plan, your plan will send you a plan annual notice of change each fall. The ANOC includes any change in coverage, costs, and more that will be effective in January. So when should you get it? You should get it in September. Who sends it? Your plan sends it. So it all depends on who, your Medicare is through. Like I said, my parents have railroad Medicare, and they're not really affected by these changes. But if you have like United Healthcare or something like that, feeds into Medicare, or however you get your Medicare, then you definitely need to read this document. Now, if you are a caregiver and you have parents or aunts, uncles, or whoever it is that you're taking care of, you need to read this document for them so you understand, what changes are coming in January. Because what I understood from this lady that was at this table, she was explaining that a lot of the coverages that normally were taking place will no longer take place for certain types of Medicare. So it's very important that you read this notice, because once that coverage is gone, once it's dropped or whatever, you only have, a certain amount of time before you can go and get more health care to cover what it is that you're missing. Like, say, for instance, if your plan now says, oh, we no longer cover diabetic, supplies, because, people are, say, using Ozempic for weight loss and they're not necessarily using it for diabetes. So now Medicare might say, hey, we're not covering that anymore because people are using it for an unintended use, and we don't have a way of truly monitoring that. So if people really need it, they'll pay for it. So say, for instance, Ozempic is one of the drugs that you use, and it's extremely high, and you can't afford it because when you're on a fixed income and you're on Medicare. So what do? So prior to you getting to the point where you need it and you don't have it, make sure that you're looking at this ANOC. Make sure that you understand what it is saying, because if you don't understand what it's saying, you need to reach out and talk to someone, preferably a licensed insurance agent, that can tell you, what impact these changes are going to have. Now, scroll down. They don't have like any publications or any downloaded samples or anything like that. But they do tell you down here where it says take action. If you look close to the bottom of that list, next to the bottom, it says talk to someone. And I know a lot of people that are on Medicare, of course, you don't want to deal, you know, with that automated system or these little chats and things like that. You actually want to talk to someone. So you will click this link. And then here's the number, 1-800-Medicare. And if you are having trouble with hearing, then the number you call would be 1-877-486-2048. Now, if you're bold and beautiful and you want to start a live chat, you can also click that link down below. And they're there 24 hours a day, 7 days a week, and they should be able to answer your questions. But make sure that when you call, you have a copy of this ANOC with you, because if you don't, it's kind of hard for them to be able to talk you through your specific situation if you don't have your specific information in front of you, because everyone's situation is going to be different. It's not like, say, person A, you know, gets high blood pressure medicine and person B has to see, say, a hematologist, but they don't have high blood pressure or anything like that, but they have like hemophilia or something and they need to see a particular doctor. With those two people's Medicare plans and the ANOCs will be totally different, because it's catered or it's centered around your situation and what type of healthcare benefits that you have based on your situation. So please don't wait till the very last minute to get this paper or look for this paper like in December, because in January is when the changes take place. Would rather for you to do it now. Call Medicare, get all of your questions answered, put a plan together if you're going to have to purchase some additional health care, or talk with them about some other options in case you can't afford additional health care. Don't just not take, you know, this medication. So there's another side of this. If you are taking these medications and say the doctor becomes one of these ones that isn't accepting Medicare, and I don't know if they can or can't do that. I'm just saying, what if this is the possibility? Well, if that's the case, then how will you handle that? What, you know, what will you do if the doctor you've had for 10, 15 years is now out of network and you can't go to them without paying a huge amount of money out of pocket? So it's very important that you understand your ANOC. All right, so now that we've kind of talked about that, there's something else that I really want to petition you and talk to you all about. So lately, I know I've been giving little bits and pieces about the things that have been going on, you know, with my body, and some things that I've been doing different to combat the issues and the illnesses that I've been dealing with. So I have decided to reset my gut. And everybody's like, oh, you know, how do you do that? You know, you can drink all these juices and you can eat nothing but fruits and vegetables. You can do all different things. Well, you can. But the problem is within the US soil, because we have to make so much food so fast, we end up putting some unnatural things on our crops and in our ground in order to make the stuff, you know, grow faster, bigger, make more of it. And it's having a detrimental effect on our body. Sure, it's filling our tummies when we're hungry, but what nutrients, you know, are we actually getting from these things? And who wants to eat a bunch of, you know, empty calories that's doing nothing, you know, to help you? So I really didn't understand that, because I was sitting here trying to eat vegetables and eat fruit and, you know, exercise and do all these different things. And I noticed I wasn't losing any weight. And I noticed that I wasn't feeling, you know, any better. But I didn't start noticing a difference until I started taking a product called LOVEBIOME. Now, if you want to know more about this product, put it in the comments. That way I can reach out to you directly get you connected to the correct path to make sure that you get all of your questions answered. Because I'm just really new in this. I just know how good it makes me feel. For instance, I've played tennis for 32 years, and the toll has definitely been taken on my joints. And I had gotten to a point where the ladies I played tennis with, they felt sorry for me because I was wearing braces on both knees. I had one on my wrist. My ankles were always swollen. I couldn't like drive after matches. I was in pain. Everything hurt. And I would go to work. And the guys at work would, just be like, man, she's out there trying to walk across the way, or she's trying to walk here, or do this or do that. She looks like she's in so much pain. She just needs to stay in the office. Now, I'm not gonna lie, I wasn't out there all day, every day because I was in so much pain. So when I did go out and they did see me, they knew that I was in pain too. But as of late, since August 16th, when I was first introduced to LOVEBIOME, I took my first shot of the superfoods and the superfruit and the Phyto Power Pack. And from that point, it took 3 weeks. I no longer had any joint pain. I did not have the inflammation and the swelling that I had in my joints. I even called my orthopedic doctor because they kept calling me saying, hey, you ready to get your shot in your knee and all stuff. It's like, no, no, no. Cancel the shot because I'm not in that pain anymore. I do not have that issue anymore. And it was just kind of like, okay, thanks, bye. So I have found something that has helped to heal me from the inside out. And you all know that I have thyroid cancer, and I went and I did my labs on yesterday. So I'm waiting in a couple of weeks. I should be able to come on and give you guys an update and tell you, what the results are. But first and foremost, I'm believing God for total healing. But secondly, I know that He made all of these things to heal us from the inside out. And because of how these ingredients were carefully selected and placed into one specific thing to take, then I don't know why anybody wouldn't want to try that rather than having to continually pop pills. Because when you're taking all these pills, all it does is mask the symptom that you have. And then it causes something else somewhere else. Like, for instance, could be taking, I don't know, some type of anti-inflammatory. And it makes the inflammation go down, say in your knees and your wrists and elbows and ankles, but then you start having spikes in your liver enzymes because it is causing issues with your liver. And it's like, oh, well, it's just a side effect. Natural remedies don't have those kinds of side effects. So wouldn't you rather try something natural that is going to help heal your body from the inside out rather than try something that was, made from fillers and plastic and all these other things that you don't know what they are? Heck, some of it's even poison. You don't even know what it is, but you're taking it because that's the thing to do. That's what we've been taught, to take medicine when you're sick, to take medicine when you want to lose weight, take medicine when your hair is falling out. You take medicine when you have, cancer, diabetes. Now, I'm not saying to stop taking the medication that you're on. I'm not saying that. What I'm saying is, why wouldn't you want to try something that's natural, that can help heal you so you don't have to take the medication anymore? So imagine starting to take this. You go see your doctor, and your doctor's like, hey, your blood pressure's great. Potassium levels are great. Your triglycerides, they're wonderful. Cholesterol, everything is great. What are you doing? And you tell them that you have been taking a nutraceutical, something that is not regulated by the Food and Drug Administration because it contains no drugs. It only contains natural ingredients that will help your body. And that's what I'm doing. Now, I invite you to go and look at some of my older podcasts prior to, like, let's just say prior to this one. Let's go anything prior to August 1st. Look at any of them prior to that and compare it to this one. You can see that my skin is clear. My hair is a lot thicker as well. And you can see that I've lost weight in my face. So why wouldn't you want the same for yourself? Don't you want a healthier version of yourself? Sure, you can keep living life the way that you want to live it. But if you change one thing, you could potentially change everything. You could change the way your body feels. You can want to get out and play with your kids more, your grandkids. You'll want to go for a walk. You want to travel. You want to do all the things that you wish you could do prior to being in the situation that you're in. So who wouldn't want to try it? And if you are interested in trying it, I'll have a link in the show notes so you can check it out for yourself. All right. If you have any questions, please, please, please feel free to comment below and I will reach back out to you. And that's both to the people who have questions concerning Medicare, because I know I'm not a Medicare expert, not at all. I am not a medical health professional. I am not a licensed insurance agent, but I am a concerned person who loves people, that cares about the elderly and cares about everyone's health. And I want everyone to be better, one life at a time. Even if only 20 or 30 people hear this message, those 20 and 30 people can be made better by the choices that they make from hearing this message. So, as always, thank you so much for taking this time out to talk with me, or should I say, listen to me talk on Embracing the Fight. This is episode 90, and this just discussions about health, just discussions about healthcare, Medicare, all that. Nothing too serious, nothing too strong. But just know that I want the very best for you. Each and every time that I get on here, I'm thinking about you, and I'm thinking about your health, and I'm thinking about your journey as I continue to embrace the fight. Thank you all, and have an absolutely amazing day.